As the quarter has drawn to a close, I wanted to share some insights on operational matters across the group, in part as a courtesy to some who've asked questions of the company in recent weeks. In May 2022, we launched a series of company events, soirees and luncheons, engaging new audiences with the CLINUVEL story. Our assessment was that after the social isolation of the COVID-19 pandemic, the world was ready to meet in person, but we needed to do more than other companies. We wanted to tell the story in a unique way so that it would resonate with a wider audience, particularly given that we have a larger looming story coming together, and thus the soiree series was born. Our last soiree, held in New York at the NASDAQ on the 29th of March, was really well received. And for those who are curious, the slide deck that we released to the ASX illustrates the direction the company is taking in photomedicine and the progressive next steps of the group. Now, the choice of NASDAQ as a venue, of course, raised some questions as to the company's intentions, but it shouldn't be a surprise. For a long time, we've publicly discussed the potential versus the pitfalls available to the business when assessing the location of listing. We increasingly have a North American story to tell, and there is a constant assessment amongst the management team and the board as to whether a listing elsewhere outside of the ASX would help that story gain greater traction. We're not there yet, but we are certainly assessing the necessary criteria that might enable such a change. Now, what is clear, having watched peers and also other cases, is that we won't go halfway. We won't consider a dual listing. If a change is seen as necessary, then it will be a complete listing change, a re-domicile of the business. In terms of global events, Malcolm Bull and his team have much more in store this year, and I'm really looking forward to it. We're 1 month on from the test launch of CSL, our first polychromatic screen, and the first product that we've made available from our personal care, part of our arsenal of photomedicine. There was a strong logic behind the choice to make the product available to patients with erythropoietic protoporphyria and xeroderma pigmentosum, as well as offering through our e-commerce platform in Europe. So far, we're really happy with how the feedback that we've been getting and how the commercial infrastructure is functioning. As a next step into the next commercial phase for our personal care products, I think those who watch the company closely will get a better sense of how these products are positioned. Our approach to longitudinal care, born of our pharma experience, rather than the standard digital approach that just sees a single click and a conversion. It very much reflects how we've built a successful business over the last 20 years. Now, there is much more to come here, including new products in various stages of development, but ultimately the goal is to make 4 distinct product lines available, 2 across photoprotection, DNA repair, and maintenance of pigmentation. From the outset of our clinical program with SCENESSE, we've deliberately taken a selective approach towards those professionals and centres with whom we work. This is perhaps an unorthodox approach in the industry, but we strongly believe that you need to have a high level of trust and confidence in the professionals with whom you work. This is healthcare at its best. You're facilitating a treatment for patients who lack alternatives. If we don't deliver or trust our partners to deliver, then there are fundamental issues that would impact people's lives and the lives of their families. It is a responsibility we take seriously and even personally. So if there's a misalignment or a conflict of interest, one's asked to take a decision, putting the patient first and really at the center of that decision to understand how they may be impacted long-term and short, and the lengths that you go to so that you minimize or eliminate a possible future or immediate impact. Now, at the start of each treatment season, there are many late nights, many early mornings from the global team in Europe, Australia, and the US to ensure that patients can receive or continue to receive care. In the US specifically, we've built a network of specialty centres to treat patients with SCENESSE. And over 50 of these centres are now trained, and there are plans to expand this to 120, capable of treating not just EPP patients, but also xeroderma pigmentosum and vitiligo, so XP and vitiligo patients. Dr. Lin Teng and her team are in daily contact with this network with a view to ensuring that those eligible patients who demand treatment are capable of receiving it. Now, for me, I was particularly excited to see that the team has now facilitated the first access for Medicare and Medicaid patients, recognising that around 1/3 of patients in the US receive treatment through some sort of government program. It is an ambitious and bold statement to say that we want to be a household name by 2026, but this is the objective set. We have a strong foundation with both clinical and new product development programs that can deliver a new level of visibility for the company, but more importantly, have the potential to change the lives of so many who to date have been neglected by our industry. For me, I'm particularly excited about the DNA repair program, which has forced our team to think differently, developing a new program, but new protocols, new instruments, new assessments. But this really might have a profound impact on patients and beyond what it is that we've achieved in photomedicine to date. So in many ways, CLINUVEL is a company that seeks to translate the evidence in a small domain to relevance to larger populations. That really is translating for you and for me. Maybe I say that a different way. Part of our objectives have always been to use proof of concepts in quite contained environments to find wider relevance for many millions of people. And we're succeeding in doing this. It's exciting, and certainly it's a privilege to be part of the team that I think will deliver on this.